Welcome to BW Healthcare World. When we speak about healthcare, we must not ignore oral health. Oral hygiene has been something which has been ignored until a problem arises and a patient requires to go to a dentist. Today, dental services have gone beyond the clinical requirement for you to go when you get a pain. It has evolved to be focused on aesthetic dentistry. Today, my guest is Dr. Shantanu Jaradi, someone who, after completed his dental education, took a break of a year to understand the market, and then he started a dental chain called Dentzz Dental. Based in Mumbai, he understood the challenge around the experience that is getting created for the patient when they visit a dental clinic, and he focused on that. He opened a chain of clinics which is now present in Delhi, Mumbai, Ahmedabad, and also has gone cross borders and has clinics in Dubai. Today, let's speak with Dr. Shantanu Jaradi on where does he see aesthetic dentistry going in the near future. So, Dr. Jaradi, welcome to BW Healthcare World. My first question to you is, dentists are usually known to have standalone practice or a group practice where two or three dentists get together and they set up a clinic. How did you think of setting up a dental chain, and how did the journey begin, and how has the journey been for you at Dentzz?
Thank you very much, and thank you very much for having me here. And that's a great question up front, because that was the first thought process behind me initiating this project. As to, I never wanted to start a standalone practice, and I always wanted to have a brand with multiple locations and a business with larger reach. And the main reason behind that is because I was fortunate enough to realize early on that if I have a standalone practice, and I might have a great practice, but at some point it's going to reach its limitations, right? It's going to reach its limitations because a practice will be mainly driven by me as the operator and less to do with systems, protocols, etc., which is actually essential to drive a business as such. So I thought, why not, let's just start a brand. I started only with two locations because I didn't have the startup capital to do so. I started only with two locations, and I said, let's learn the art of the practice. At the same time, it's not just the dental practice, but the dental business as such, right? So let me develop systems to run a dental business successfully, not in one location, but to be able to replicate those success over multiple locations. And that was the clear thought process right from the beginning. And that's how my journey began.
Got it. And, Dr. Jaradi, dental treatments are always perceived to be expensive. Mm-hmm. And also there are, there was a time when there weren't so many dentists, but today things have changed. We have lots of dentists getting produced every year in India. How do you and your team differentiate yourself from others?
Right. So I think there are two aspects to this question. First is it's being perceived as expensive, and I'd like to throw some light on that because that's a very important point that you raised. And the second is, of course, our differentiators. Right. Now, when we say perceived as expensive, we have to say perceived as expensive in comparison to what, right? If you're going to make a vehicle purchase of 20 lakhs, 30 lakhs, 40 lakhs, 10 lakhs for that matter, the life of that vehicle is 3, 4, 5, 7 years. But if you're investing, and I'm using the word investing, not spending on your dental treatment, because whatever money you're going to invest here, it's going to benefit you from a long-term perspective. It'll prevent further problems to begin with, right? And if it's done well, it's going to stay with you for 10 years, 15 years, 20 years. So whatever money you invest in your dental treatment is pretty much lasting you for a very, very long time, right? And therefore, it has to be thought as such. And the moment one starts thinking on those lines, then the perception becomes more realistic and not expensive or cheap and thereabout, right? So I just like to throw some lights on that front. Now, in terms of differentiators, there's not one major differentiator, but I would say there are like hundreds of small differentiators that we have and that we have developed over the last 17, 16, 17 years of being in this practice, right? So, for example, we have three main pillars of our practice. One is expertise, second is technology, third is the experience that a patient gets. No particular order. All three are equally important pillars. Now, when I say expertise, what I mean is the doctors that we have on board, they are onboarded with a very stringent selection and a hiring process. It's literally like finding a needle in the haystack, right? Because we evaluate doctors not just from their clinical perspective and their clinical acumen, but also in terms of how good are they in understanding the patient, how good are their soft skills. The dentistry is not just it's just you're not treating machines and robots. You're treating human beings, right? So one aspect of dentistry is where you are performing your clinical skills. And the second aspect is where you're actually treating the patient on a psychological front as well. So it's a dual approach. And we hire doctors who show expertise on all fronts. So number one is expertise. The second is the technology that we use. And I've spoken about technology on multiple forums before and the importance of technology in a practice and how essential it is in when you use it alongside great expertise. You have a great doctor using great tech. That combination will almost give you the best guarantee of success in any dental treatment, right? Various technologies, whatever is available in the market, we try and absorb that as soon as possible. And third is, of course, the journey, the patient experience. Like, for example, if a simple procedure like a root canal, the root canal might be a very successful one, right? Patient will not have problems for maybe 10, 15, 20 years with that tooth. But that 1 hour of procedure can be like almost painless, and the patient will be like, wow, this is like the best root canal procedure, if there is such a term, This is the best root canal procedure that I've ever had. Or in that 1 hour, the patient will be like, this was like the most gruesome and a very horrible experience. The end result might be the same, right? So, but we want to be in the first category. We want to ensure that it's not just the end result and the quality that matters, but the entire journey of the patient, their experience. That is important as well. So when we have these three objectives in mind, we start asking questions and we create hundreds of differentiators to ensure that happens. This alongside our systems, processes, protocols, you know, they ensure a certain level of predictability in the outcomes of our treatment. And these, again, systems and protocols have been devised over so many years of optimizing. And like, just to give you an example, in any smile makeover case, before it is finalized and delivered to the patient, before it is fixed on the patient, it goes through multiple approval processes. And only when it goes through that, it is finally signed off and said, and it's given a go ahead that, okay, you can deliver this to the patient. So this basically, it's not to take away anything from anyone. It just eliminates all sorts of biases, anything. It just eliminates any randomness. It just adds a level of predictability in the outcomes.
Got it. So, you used, the term that in the business, and I'm so glad that, you've used this term, because a lot of doctors and medical professionals hesitate to use this term, but they forget that, at the end of the day, you need to run a sustainable enterprise to make sure that you are able to serve people continuously. And you also, I understand that your practice has a lot of Bollywood celebrities and cricketers who are your patients. Now, when you're looking at business, there is a segmentation that happens. So, as Dentzz, what is the kind of clients that you're targeting, and how are they different from the other chains that exist? I mean, in India, we have Clove and other places. So, how are you differentiating yourself in terms of the kind of patients and clients you are targeting?
So, like it we unlike conventional businesses who say that, you know what, this is our target audience and this is our target group and we want to target this. We don't do all of that. We are actually very focused inwards. We say that, you know what, we want to provide a certain quality of care. We want to provide a certain quality of experience. We want to give this out. Okay. Now, when we are doing that, it's again the business metrics. Because it comes at a certain cost, right? The doctors that come on board eventually, we do have to pay them a certain amount, which is significantly higher because of the quality of care that they provide, right? The technology that we absorb, it comes at a certain cost, right? So then what we do is we say that, okay, this is what it is. It costs us, and then that's how we establish our cost metrics. And then we are like, this is what we have to give. Whoever feels that they would like to avail of this is welcome. And this is how our approach is. We don't segment. We don't say top 2%, top 3%. We don't do all those things. Now, when we do this, what we have observed is that we get our patient base is all across. It is not from any particular geography in a city. It is not from any particular city. We get people from tier 2 cities. We get people from other regions as well. So, but I think the main difference or the main classification is mainly a psychological one. Like we are catering to people who value dentistry and who want the best in dentistry. I think that is who we are catering to.
Got it. So, what does Dentzz as a chain focus on? Is it the family dentistry or is it the aesthetic dentistry? And what percentage of Dentzz procedures account for aesthetic dental procedures?
So basically, we mainly focus on uh, elective procedures and advanced procedures like smile makeovers, dental implants, full mouth reconstructions. That is where our forte actually lies, and we are known to produce exceptional results when it comes to these kind of procedures. These are mainly elective procedures. These are procedures where a person generally does once in their lifetime. So this is what our forte is. As far as routine dentistry or family dental or general dental procedures, we of course do that as well. But in terms of our strategy, that is not a part of our core strategy.
Got it. So, Dr. Jaradi, you mentioned that there are three pillars that your practice is built on. One is the doctors, the practitioners that you hire. Second is the technology, and third is the experience. Now, uh, the key differentiator in my mind, what it comes is the experience that you are able to create. How does a person, like you yourself mentioned, that 1 hour that the person spends with you during the root canal being done? So how do you differentiate yourself? What kind of an experience are you creating for the patients or the clients for Dentzz?
So it's like that happens at multiple fronts. So if you visit any of our centers, you get to know they look like anything but a medical facility, right? In fact, the dental equipment is there. That is something which I can't do without. That is the only thing that makes it look like a medical facility. But otherwise, care is taken to ensure that everything else doesn't look and feel like a dental facility, right? Our entire team is given thorough training on effective communication, how to deal with all the other aspects related to the practice. Our doctors are given thorough training on communication before a procedure, during a procedure, after the procedure, you know, managing the patient on a psychological level. Then, in terms of the procedure in itself, like the same anesthesia can be given in a very rough way, the same anesthesia can be given in a very gentle way. There are processes involved in that, right? So we take care on a very micro level on a lot of things. And then when you add up all these things together, the entire experience is just completely different for the patient. You're like, wow, this is like completely different. I've never experienced anything like this before.
So the experience is where your core differentiation lies.
Absolutely, and absolutely. That is a non-negotiable part of our operation.
So, Dr. Jaradi, how has the demand in the past few years uh, changed or evolved when it comes to aesthetic dental procedures? What is the quantum change that you have witnessed in the last few years for aesthetic dentistry?
It's a dramatic shift. Like, way back in 2006 when we started, aesthetic dentistry was like in its baby stages. People weren't even aware that these procedures exist. So when people used to come to our practice back then, we had to first really educate that these are the procedures that are there, and they're like, "Oh, we didn't know about this," and we had to explain to them the pros of that and the advantages of that, and so on and so forth. Compared to today, where it is an essential part of one's where someone is out there looking for various makeover like procedures. Everyone is aware that these procedures exist and the benefits of this. So we have seen a manifold, like probably 20 to 30-fold increase, at least in our practices, of the number of procedures that we do over the last 10 years. And I feel along the way, along with general awareness, what also has triggered and boosted the demand for these procedures is, of course, I feel, this is my personal opinion, is social media, right? I think that has really increased the demand for that. Then during the pandemic, a lot of people were on Zoom meetings, and then all of a sudden they realized, hey, you know what? I need to get my smile fixed. That I feel is triggered. So there'll be few triggers here and there, but the demand is increasing, and the demand is growing at a rapid pace.
So I know that Zoom has changed a lot of businesses, but I didn't know it had impacted dentistry as well. I'm glad to know. But Dr. Jaradi,
Yeah, yeah, yeah,
when you look at
yeah.
aesthetic dentistry, when you look at smile makeovers, which are more, what do you call it, treatments that don't cause a pain, but is helping you groom yourself. These were always thought to be something which was for celebrities, people in the glamour world, models, etc. But has that now been transformed and made it available to the masses in general? Do you find that shift where people in general are wanting to look good and they are approaching for aesthetic dentistry? And what do you see is the probably the size of this industry?
So this used to be the case in the early days where people used to think that this is for celebrities, and then we had to educate them and say that no, this anyone can undergo these kind of procedures. But not anymore. Now it has become an essential part of any facial makeover procedure, right? It has become how people go for fillers or Botox. This is essential, and people have realized that, and people are aware that now this is accessible more than ever before. So I think the awareness is there, and the demand is there, and people now do not consider it anymore that this is only reserved for celebrities, but now they feel that this is how I would do a filler or how I would do a Botox. This is also required along with that. Like that is the general perception. What I see is there in the market right now.
So, Dr. Jaradi, you have clinics in Delhi, Mumbai, Ahmedabad, I know many more cities other than Dubai. Uh, in India, what we've seen is that the purchasing power or the affordability in the tier two cities has gone up considerably. So, what are your plans to
Yeah.
go into tier two cities in India?
So although we see a lot of people traveling from various regions, because see, this is an elective procedure, this is a one-time procedure. So people do, and there are people who really want the best, and they do travel for this. So we get people from all over, but and the demand is increasing with time, and I have no doubt that in future, the demand in tier two cities will be even more than what it is today. I'm very sure of that. Yeah.
So, Dr. Jaradi, technology
Yeah.
is impacting most in most fields within healthcare. How has technology advancement impacted dental procedures in the past few years? We know that 3D printing has impacted dentistry in a way, but how far are we from robotic surgeries and where are we headed? Is AI going to play a role when it comes to dental procedures?
So yes, technology has brought in a dramatic shift in the entire way dentistry is practiced today. It has, if it's used right, and not just a single technology, but even if you combine various technologies together, it just increases predictability. It increases the chance of success, increases the success rate, and reduces the chances of any complications. So it has dramatically shifted the way dentistry is practiced right now. Moving forward, when we talk of AI, when we talk of robotics, that is definitely the future, but it is still early days yet, right? But I have no doubt that now that will be the future where AI will have its role to play in the practice. It will be absorbed. It will be like mainstream in the near future or sometime. Robotics will be there, but we are along that journey yet. We are not completely there yet.
So, Dr. Jaradi, we spoke about
Yeah.
that how you chose to set up a chain of dental clinics rather than restrict yourself and limit yourself by just managing your clinic by your own self. Now, the challenge that comes in is that when you work yourself, there's a passion driven. But when you hire people, they may not share the same passion that you may have. So, my question to you is how do you ensure quality of services and the commitment levels across all clinics that you run and ensuring minimum standards and standardization of procedures and clinic management? Um, how do you manage all this? And is there a role that technology is playing in ensuring this happens?
Yeah. So, like you said earlier, that is the challenge, right? If you have a certain passion and you want to do something, how do you ensure that other people also share the same passion? And that that was the biggest challenge for me earlier on. How do I overcome this challenge? So, am I audible? Yeah.
Yes, you are. Yes, you are.
Yeah, yeah. So along the way, I realized that you can have systems, you can have protocols, and they are absolutely essential to ensure that everything goes well. But systems and protocols will never be a substitute for right people. Essentially, the art is about getting the right people on board. It is no doubt very rare to find people who share the same passion, but they do exist, and the art is in finding them. And that is something which I've learned along the way. And I'm very proud to say that today, each and every member of my team, in whichever location, I'm certain that they share an equal amount of passion that I do today.
And and how do you manage the minimum standardization across all clinics?
Can you please repeat? I couldn't get that.
Yeah.
Your
So
voice
how,
was breaking.
how do you manage minimum standardization across all clinics?
We have got very strong systems and protocols in place. Each and every work is that is done in each and every center. It is documented. It goes through approvals. It is like there is no randomness in our practice. There's no randomness. There is nothing discretionary. There's nothing left to biases. Everything is observed, monitored, controlled, and we are certain. And there's a level of certainty that exists in all the work that happens here.
Got it. Well, Dr. Shantanu, that brings me to my last question for the day, and which is that what are your plans for Dentzz? What do we see coming? Is the growth going to be coming from India, expansion in India, or are you going to be expanding further in Middle East, or are you looking at more countries to expand Dentzz to?
It will be both in India and Middle East, both, because we are fortunate to have a presence in both these regions, and also a great amount of experience also in both these regions. So there's a lot of learning of these two markets that we have, and we can capitalize that and actually have expansion in these regions moving forward. Not only that, even expansion of our current infrastructure, because we are constantly falling, and it's a happy problem, we are constantly falling short of infrastructure because of the demand that we have. So along with the geographical expansion, we also have to keep expanding our current facilities as well. So that is what the future holds for us.
Awesome. Well, thank you so much for taking out to speak with us, Dr. Shantanu Jaradi. It has been a pleasure to have you at BW Healthcare World.
Thank you very much. I really appreciate everything. Thank you.